a lot about headlines, media literacy, critical thinking. And I got a headline. You know, this is one of those headlines that you read this and you're just like, what? And I'm going to show it to you in a second, but check this out, okay? This is from CNN. The virus threat is easing, but U.S. hospitals are still as full as ever. So the threat is easing, but hospitals are nearly at capacity. So the threat going down, hospital capacity going up. And those are happening simultaneously. Like, but okay, all right, sure, all right, I'm ready. I put my seatbelt on, I'm ready for this, okay. At a Massachusetts General Hospital in downtown Boston, the hallways of the emergency department are lined with dozens of patients waiting to get a room upstairs. Quote, imagine spending days and nights in the hallway under fluorescent lights to the ER. In the ER next to a trauma bay while patients have heart failure, kidney failure, or pneumonia, said Dr. Melissa Madison, a physician-in-chief of hospital medicine at Mass General, which is a founding member of Mass General Brigham. So when I hear that quote, I'm hearing good news. The threat going down. Oh, great. People in the hallways? Awesome. The threat must clearly be going in the eye. Like usually, right? Like usually these kinds of articles that have this kind of headline, they usually hide the ball. But like this one is like, they're not even bothering. It's just like, yeah, there's no big deal. By the way, let's tell you how our hospitals are fucked. But no big deal, yo. Quote, everybody's doing their best. First of all, I don't believe that for a second. But where do they go to the bathroom? How do they take a shower if they want to clean up? How do they eat? There's no privacy. It's just awful. It's awful. It's absolutely awful. As of Friday, about 87% of all available hospital beds in the state are in use, and capacity strains have eased little despite a dramatic decrease in the number of people being treated for respiratory illness. Okay, so wait a second. So 87% of available hospital beds. Now again, it's not just about the beds, right? You can have a bed, but no nurse. So what are the staffing levels here? Are we having staffing shortages? Because most hospitals in America are having staffing shortages. But let's keep going. Every day, our emergency room has a backlog of anywhere between 25 and 100 patients waiting for a bed upstairs. So if today that number was 25 and 2 weeks ago it was 100, yes, that's better, but there's still a long line, Madison said. I love how, like, this quote is like, yeah, I mean, it's technically better. And then CNN is like, well, you heard it here. The threat is easing. What? What? Maybe the patients aren't piled like sardines in the ER as much when you only have 35 patients waiting compared to 75, but it's still not great. The media is like, oh yeah, don't worry about COVID. Don't worry about COVID, everybody. Don't worry. Look, they said 87% of the hospital beds are full. That leaves 13% that are left. Hey, you get COVID, you want to go to the hospital. Hey, don't worry about it. The threat is easing. But again, we live in shithole USA, where up is down and down is up, my friends. Nationwide emergency department visits for the respiratory viruses are a third of what they were a month ago. Federal data shows flu hospitalizations are nearly as low as they'd been all season. Now again, the low for the seasonal low is much higher than any like seasonal high that we've had in the last like 20 years, you know. Before 2020, right? The seasonal lows that we have are basically like all-time high levels. Flu hospitalizations are nearly as low as they've been all season since October. Hospitalizations for COVID-19, the last of the three viruses to trend down, have been falling for the past few weeks, and just 4% of hospital beds nationwide are being used by COVID-19 patients. That's a dramatic shift from January 2022, when COVID-19 patients were filling up most hospital beds amid the early Omicron surge, but hospitals are still about as full as they've ever been during the pandemic. So again, right, what's happening here? Well, people are still getting COVID, and all of a sudden, so what do we know about COVID? It destroys your immune system. When your immune system is destroyed, it's worse at fighting other viruses. So you can get infected by other viruses such as influenza, RSV, and that infection will be worse, right? So, okay, so everyone's had COVID. Everyone's immune systems are destroyed. All of a sudden, 87% of hospital beds are full of people with respiratory viruses. Huh. Wow. That's interesting. Whoa. I mean, holy shit. Not to mention, what is it counted for, by the way, when they say 4% of hospital beds are being used for COVID-19 patients? Like, does that mean only 4% of the hospital beds are people that have COVID? As in, 96% of them test negative for COVID? Or does that mean that only 4% of them are specifically having issues directly related to COVID versus having COVID and that leaving the gates open for RSV and then being treated for RSV symptoms because the COVID left the door open, essentially, right? Like, I would like more information on that. Because if 87% of the beds are full, right, in very heavily populated areas like Boston, that leads me to believe that it's not the fact that 4% of the people test positive and 96% test negative. I doubt that. It's just that what they count as COVID-19 patients is, again, with COVID versus of COVID. This is a big distinction. The media doesn't really know how to communicate anything at all when it comes to this distinction. It's been a continuing trend over the last decade or so that there's been this greater acuity of patients inside the hospitals, said Nancy Foster, Vice President of the Quality and Patient Safety with the American Hospital Association. So what you see is this incredibly sick group of people inside the hospitals. If you're a doctor or a nurse or respiratory therapist or pharmacist or any other health professional working inside the hospital, that means it's always a difficult puzzle you're trying to solve to help that patient out. So more people are getting more sick from more different viruses. At Mass General, an emergency department border program, border with an A for the audio listeners out there, which outlines plans for how to cover patients who were waiting for a bed, was well established years before the pandemic hit, Madison said. Hospitals started to report capacity data to the federal government in 2020 under a pandemic requirement. But so there's no federal data to compare to pre-pandemic years. But Madison was quick to say her hospital is 99% full now, like it was in 2019, and years before the pandemic. Still, she says, how long is the waiting list and who's on that waiting list? That's not something that's reflected in the metric. Because again, you can't really poll this. You can't really create statistics out of this kind of stuff. It's really, again, very hard to discern, what patients have what, again, without going through privacy laws, of course. What patients have what are their biggest symptoms, what are the biggest complications, who is where, how does this affect? You can't really create data like that. So what we do have is COVID is the third leading cause of death in this country. And number 1 and number 2 are like groups, right? Categories, right? So cancer, what is cancer? Cancer is like 9 trillion different fucking things. So cancer kills more people than COVID. But also, what is COVID? COVID is 9 trillion different things too, right? So, but again, it's the third leading cause of death in this country, and it's gunning for that number one spot. And again, the other big effect from COVID that we know is it destroys your immune system, very similar to HIV and AIDS, right? So if your immune system is destroyed, then yeah, it makes perfect sense that we would have a situation where not many people are dying in the hospital of COVID, but they're dying of RSV, or they're dying of influenza, or some other disease or virus or illness that really only was able to get a foothold in their body because they had COVID many times. But again, we really need to stop with these distinctions. Like, all sickness is important, and we need to treat all sickness, right? The idea that we need to only care about sickness that's not COVID, or the idea that we only need to care about COVID and not other sickness, is ridiculous. Again, 40,000 people a year on average died from the flu. From the flu! 20,000 a year sometimes, 30,000 sometimes, some years 50,000, right? And we did nothing about it. So now we're basically going through that situation, except the numbers are multiplied by 10, and it's not good for anybody. And again, this is a banger headline. Virus threat easing, but U.S. hospitals are still as full as ever. Interesting stuff. Really fascinating stuff, but whatever.